Might as well start with the truth. Okay. I am ready. Over the past 2 years, I've consulted on 230 referrals and 60 long-term care facilities within the Interior Health Authority. Most referrals were due to injuries to staff and/or residents. I am thrilled that my recommendations were followed, as the only one who listens to me at my house is my dog, Ginger. The staff asked me to come and work my magic, so for the next 6 minutes, I have transformed myself into the fairy godmother of long-term care. With the stroke of my wand, I will make changes that turn my hopes into reality, starting with banning terms such as the gray tsunami. This will be replaced with respectful language, such as the generations who have built this country. We will stop acting surprised that we have a large aging population with many elderly housed in acute care awaiting placement. Rather, we will apologize that we weren't better prepared to meet their needs. Prior to moving anywhere from acute care beds, I propose an integrated team from the patient's stakeholders meets with the patient and their rep to plan the best quality of life model. Everyone's taxes funds healthcare. Therefore, all the program's resources will be shared, boundaries and silos gone. This will take a lot of fairy dust. Once the stakeholders have embraced the best quality of life model for the individual, there will no longer be the first available bed option. This will be replaced by the best available bed. After all, I didn't give Cinderella the first available man, did I? My next change will be to declare long-term care nursing a specialty. Our wonderful granny who said, "Please and thank you, dear," has been replaced by complex, medically and mentally ill seniors who usually don't want to be in long-term care and aren't saying, "Darn it," when they're angry. You know what I mean. To prepare for this complex elderly population, all learning institutes will add pieces to their curriculums. The mental health component will be expanded along with teamwork training. I will also add a new nursing module entitled, "You Can't All Teach to Be in Charge When You Graduate." I will then approve the renovation of long-term care residences to ensure private rooms. Residents are told that this is their new home, but become distressed when they have to share their bedroom with strangers. That used to be fun in the 60s. Altercations often result, and even my best magic may not prevent the use of a PRN medication. Next, I will also build residential housing for specific populations. Dementia care units will be designed by expert staff. No more dead-end hallways, please. The frail resident with dementia would live in a different unit than the stronger individual with responsive behaviors. One dementia size does not fit all. Next, I will create mental health units within the residential sites. The staff must have experience in this specialty and would receive ongoing education. A geriatric psychiatrist and team will be assigned to each facility. Seniority doesn't guarantee a position here. I may have to use my sleeping potion to get this past the unions. Inside these units, there will be safe rooms, allowing staff to protect residents from each other. These will be secure, comfortable, and have monitoring equipment to allow observation of the individual at all times. This should reduce the residents' trips to the emergency department for the purpose of medication and seclusion. The work of the medical team in residential, I'll be hiring nurse practitioners to support them. They will be joined by the RNs who were previously displaced. The multidisciplinary team must use the PIECES assessment model to ensure that they're familiar with every aspect of the individual's life. Who is the person behind the patient? The social section of PIECES focuses on the person's life, not their illness. The male resident with dementia that may believe he's at work doing carpentry, and he flips over the tables. Uninformed staff think he's destroying their furniture. Henceforth, staff that don't know their residents shall spend the day with the wicked queen. I will convince the keepers of the cash that we must add large numbers of staff to recreation departments. Most of the elderly grew up with the ethic of hard work and keeping busy. Boredom leads to restlessness, frustration, and depression, as there no longer seems to be any purpose for living. To support my quality of life model, I will change how residential is funded. Facilities submit yearly budgets that ensure they can manage the complex care residents. Current understaffing leads to resident staff injury, low staff morale, plus sick time. This makes no sense to me, even when I inhale my own fairy dust. Now that I've patched up BC's long-term care facilities, I will share what I would want for our loved ones in the moderate to severe stage of dementia. 3 strokes of my wand, and we will be in the Netherlands at the gates of Hogeveen, a secure 4-acre dementia village. The village has 152 residents and 23 houses with 24/7 staffing. There are doctors, nurses, and specialists, and the geriatric nurses are the main helpers. They are dressed in casual clothes and are viewed as helpful people to the residents who need no money to access all amenities. Freedom to move about and do what is normal is priceless. The staff also take on roles such as grocery clerks, postal workers, and restaurant servers. There are many walking trails, opportunities to go to concerts, movie theaters, dine out with your family, and assist with the meals in your cottage. There's a minimum of 1 staff per resident, so go ahead and faint, everybody. I'm moving there. As expected, there are less medications needed for behavioral issues, and residents, staff, and families and visitors all have very positive feedback. In spite of this being an expensive option, there's a long wait list to live in Hogeveen. There is a similar dementia village in Switzerland and one planned for California. Well, it's time to turn in my wand and cake. All of us have been or will be dealing with dementia, whether it be in our personal lives or our work. Please consider some of my changes, or better yet, ones I haven't thought of. Our best option is the creation of dementia villages that we hopefully won't have to live in. Thank you.